This is Dr. David W. Kim, and today's video rhinoplasty blog is about the use of artificial implants in rhinoplasty. Now, I should say up front, I don't like using artificial implants in the nose. I think it's a matter of risks versus stakes. The risk overall is relatively low that something bad will happen, such as an infection or rejection of the implant. But in my opinion, the stakes are high, because if something does go wrong, a serious complication can occur. Now, first of all, not everybody needs augmentation during rhinoplasty, so not everybody needs some additional material in the nose. The situations where that's important might be someone with a really flat nose, needing more projection to create better shape, or someone with some sort of structural deficiency in which added material might create a better overall appearance of the nose. Now, in these cases, when patients have had a prior artificial implant, the reason that an implant may have been chosen by a surgeon may be out of convenience. These implants come out of a factory. They're made from a variety of substances ranging from something called Medpor, which is a hard plastic type material, silicone or Gore-Tex. These materials, because they're preformed, have smooth surfaces, and it's significant time saving just to take it out of the package, sterilize it, and place it into the nose through an incision. The surgeon doesn't have to harvest the material from another site. The surgeon can save time in carving the material, and of course that sounds tempting. The problem is a small percentage of these cases lead to problems. Initially, the results may be good, and early on, the patient may start to see some very mild changes, such as a little discoloration or redness under the skin, as you can see in this individual. Over time, a complication like this may progress, and the skin may become progressively red or blistered. Some undesired contour changes can be seen to show through the skin. And over more time, the problems can progress in creating significant infection, fever, drainage, purulent discharge. All these things can result. In really severe cases, the implants can actually start to extrude or come out of the skin. Some of these pictures were taken from the internet, from a variety of other educational sources. But you just need to spend a few minutes doing a search on implant infections and you can see these type of problems. Implants are different in the nose than they are in other areas. A lot of patients get breast implantation. I'll even use the use of silicone implants for chin augmentation. Those areas have a much more padded soft tissue covering over the implant that greatly reduces the risk. Because the nasal skin is relatively thin, and because of its proximity to the inside of the nostrils, which is a dirty area filled with the normal bacteria that resides there, there's a greater chance of introduction of germs or bacteria in and around the implant, which can lead to later problems such as infection or rejection. In really severe cases, even after the implants are removed, because of all the infection and scarring, the nose can become further deformed, as in this individual. And then in these cases, when the implants are removed, you can see that it's just a mess. This is a case that I performed in which a silicone implant was combined with some Gore-Tex as well as some other material to create a profound augmentation of the nose. All of this foreign material caused a problem in that individual. When there's a solution such as cartilage grafting, which I believe can be done safely, effectively, although it does take a little bit more time, it significantly reduces the risk and possibility of long-term complication. This is a patient in whom I performed a rib graft to fix the traumatic nose, better contours on the front and side view, and another gentleman for revision rhinoplasty with another rib graft, creating better contours again on the front view and the side view. Overall, I think the risk or likelihood that something really bad happens as a result of an artificial implant is relatively low. Some people in the literature say about 5%. But I don't want even a 1 in 20 chance of something like this happening, because although the risks are low, the stakes are high. A 1 in 20 chance sounds okay, but if you're that one person in 20 who gets one of these problems and it has a severe life-altering complication, it's not worth it. Cartilage grafting is safe, effective, and I think a superior overall option in these type of cases. Thank you.